Thank you very much for taking over being the president at short notice. I think you can imagine last week was a bit of a jolly miserable council meeting. And it wasn't just losing the president, but we realised we didn't have a lecture programme. That was the emergency. So one thing we're very good at is fixing emergencies. So the whole council pulled together, and because I already had a bit of a lecture on my laptop, I said I'll do the first one. So this is a bit of gossip. It is very gossipy, and some of it is downright scandalous, so I hope I don't offend any of you. And it's a few hundred years old, so nobody that's mentioned in this talk is still alive, and that'll be fine. So who am I? I have been a consultant at King's Mill since 1998, and I'm a made in Nottingham person. I came to Nottingham Medical School in 1975, and we were the first year in the new building. So the medical school moved from the cowsheds down to the new hospital. So I'm very proud to be a Nottingham product, and I just stayed here because I liked the hospitals, I liked the people. And although I went to places like Chesterfield and Derby and Leicester, and there are people here from nearly everywhere I've worked, and one or two people that I've trained as well, so that's very nice to see them in the audience. Basically never really left Nottingham. And my first year out of house jobs, I did an anatomy teaching job at the medical school. So I'm sorry if I've put a bit of anatomy into this and you hated anatomy at medical school. There's not a lot, just a little bit to illustrate the gossip, really. And since December the 13th, I've been the Vice President for Education at the college. So I thought I should probably talk on an obstetric sort of theme. And the reason I'm talking about this doctor, it's a story of a doctor, is that in 2017, I found myself speaking at the RCOG World Congress in Cape Town. And Cape Town is where this story is set. So I heard about this doctor in Cape Town, and I thought he was really interesting. So I bought a book about his life while I was out there and read it on the plane coming back. And then I bought another one when I got home. And you'll understand by the end of the talk why I was so interested in him. And I'm just hoping that nobody in the audience knows more about him than I do, because I haven't done the PhD in medical history or anything like this. It's just based on a couple of books that I've read. So I would like to introduce you to Dr. James Barry. Rather handsome looking chap. There are lots of portraits of him on the internet. Unfortunately, they're a bit fuzzy when you steal them to put on your laptop, but I think you'll understand what we're talking about. And he, like many doctors of the age, was a military surgeon, so there was a really good career to be had in the army as a doctor in those days. So why I'm talking about him is that in Cape Town, he did a caesarean section without anaesthesia, where both the mum and the baby survived it. So it's a sort of bit of obstetric history. So let me introduce you to him and tell you about his life story. And it started in Edinburgh. I guess we might have some Edinburgh graduates in the audience, at least one. So he's an alumnus of Edinburgh, just like you are. In those days, it was a 3-year course, and you didn't just enroll to do medicine, you did literary studies or something like that as well. So he was enrolled as a literary and medical student. Now, the gossip about him started really about at medical school time, because he looked very different from the other medical students. He was much shorter by a long way from the rest of the group. He had a very girly sort of face. And actually what they thought was that he'd falsified his date of birth to get into medical school, and that he was a good deal younger than he said he was. But they did let him into medical school. When it came to finals, it came to the crunch, and the university really were quite worried about the date of birth issue, because he didn't have any papers at all proving his date of birth. They weren't going to let him sit his finals. Now, luckily, he had friends in high places. So he had an uncle, also called James Barry, who many of you will have heard of, James Barry R.A., famous artist. And this is a self-portrait that hangs in the National Gallery, which James Barry, the artist, painted of himself in 1803, so 3 years before he died. I don't think he's as good looking as James Barry, the doctor, by a long way. But anyway, he had a friend who was basically sponsoring him in his painting and his other artistic work, who was the Earl of Buchan. The Earl of Buchan knew lots of people in Edinburgh University, and he persuaded the Senate to let James Barry the Younger sit his final examinations. So, in 1812, he sat his finals, during which you had to defend a thesis. So, if I had any medical students in the audience, which I don't, and they're moaning about their finals, this is not a patch on what James Barry had to do, because not only was the thesis written in Latin, it was vivaed in Latin too. Now, that's a pretty tall order, I think, for somebody aged about 22. So that's the front page of his thesis, which is a bit old and battered now. And he did it on hernia. So hernia was a bit of a thing in Edinburgh at the time. So there was a lot of research coming out, a lot of papers written. Most of the faculty that were doing surgery were interested in hernia. And he chose femoral hernia for his thesis. Now, I say astutely because most of the faculty were interested in that, so I suspect he got quite a lot of useful supervision. And the title is Disputatio Medical Inauguralis Demerisial Vel Hernia Crurali, a dissertation on femoral hernia. So you remember the hernia outlets? If it's a femoral hernia, it's below and lateral to the pubic tubercle. If it's an inguinal hernia, it's above and medial. I think that's what the thesis was about, more or less, because they didn't do much operating in those days. So the other thing I think that was in his head is he had an eye on a house job in London. And in London was this very famous Sir Astley Cooper, who had just published 7 years before a treatise on hernia. And this hernia rather cheekily challenged quite a lot of the concepts. But if you want to look like a bright spark and get a good house job in London, this is probably not a bad thing to do. So I'm going to talk about Astley Cooper for a couple of slides, because again, he's a pretty handsome chap, isn't he? And aristocracy as well, and a fellow of the Royal Society. So he had a very prolific output in terms of anatomy and surgery publications, a lot of which was about hernia. So he's a London teaching hospital consultant, the best dressed men in London. Sort of agree with that, I think, but was a great teacher, and I think probably a very good person to work for as a junior doctor. Some of you will know this, which is his motto for what a good surgeon needs. An eagle's eye. Well, I've got a lady's hand. I think I've got a lion's heart, actually, because this is what we do every day in the operating theatre. I quite like that motto. I think it's a good one to live by if you're a surgeon. So Astley Cooper. The ligament of Cooper is part of the hernia area. It's just on the pectineal bone, on the pubic bone. You can just see it there's ligament of Cooper just underneath inguinal ligament. So we knew his name as first-year medical students when we were learning this bit of the anatomy. So James Barry, having passed his finals in Edinburgh, signed up to do his postgraduate studies in Guy's. And most of the anatomy lectures were being given by Astley Cooper. The enrolment fee, instead of, what is it now, £9,000 a year for an undergraduate, 20-something for a postgraduate, 6 shillings and 2 pennies to go and start studying at Guy's and Thomas's. There were only 24 of these posts. So, you know, at least we got paid as housemen, didn't we? We didn't have to pay the hospital to go and work there. So, what happened when you went to do your house jobs in Guy's and Thomas's? There were only 4 working for Astley Cooper, and Astley Cooper was able to obviously to take his pick of the brightest. And so I think James Barry was jolly lucky to get one of these 4 posts. Has anybody been to this operating theatre? It's the old operating theatre museum opposite Guy's, and you go up a spiral staircase to the very top floor. Behind the coats hanging in the corner is the door to the old ward, which is no longer there. But originally there weren't any lights in this operating theatre. The operations were done by light from the skylight, so it was all natural light. So they probably couldn't see very well. Neither did they have any anaesthesia. So I think being brought into here and laid on the wooden table must have been a jolly nightmare for the patients. So if you go and see this museum, which is well worth a visit, they will do a little mock operation for you, a sort of show and tell with the patient shrieking quite a lot. It's a bit of an ordeal actually, unless you're a doctor. So when I went down there in May, it was with 50 gynaecology ladies that we were on a women's visiting gynaecology club visit. And I didn't tell the guy till afterwards that we were all doctors. I thought he might be a little bit worried about having to speak to an entire audience of doctors, but anyway. So what the dressers did was they sat by the operating table or stood by the operating table in the well of the theatre, and they basically did the dressings, did the suturing, cleared up the blood, learnt stuff. And so the surgeon was a bit of a showman doing the operation. Somebody else was holding the patient down and the dressers cleared up. Now, I like this quote from the books that I've read. They worked long hours and were frequently given responsibility for problems beyond their experience. Now, I would think if you go to my hospital and ask my F1 doctors what their job is like, they'd probably say very much the same thing. So, plus ça change. Now, I'm quite impressed with this guy's intellect because he got through the Royal College of Surgeons exams within a year of his finals. It took me 5 years to get FRCS. I think probably the most difficult exam I've ever sat. Then he joined the army, passing the army medical examination with absolutely no problems at all. And his first job was in Plymouth. However, a little problem with his appearance again. So basically, they said he can't come and work here, he looks too young. Again, somebody in high places intervened and he was able to start his first paying job. So I think in medicine it's sometimes who you know as well as what you know, and it was always like that. So a little bit about Barry himself. There was a lot of gossip about him, and he was sort of famous because of the way he dressed and the way he spoke. And I love this quote from the book about his coats. He had a lot of wadding in them that made his shoulders look broader. I love the stacked heels, make him look taller. And he had the heels dyed red to match his hair. Well, his hair was a wig, a red wig, but sounds lovely, doesn't it? Bit of an odd chap. He dressed very flamboyantly and became the subject of gossip on account of his thigh-high boots, tight breeches, pea-green coats and bright red wig. You've got a measure of the guy. He was a bit unusual. So after Plymouth, a couple of years in Plymouth, he ended up being sent by the army to Cape Town. Now, at that time, Cape Town wasn't a very big colony at all. It was 3 months away by ship, and it was a little bit like the Wild West, slightly lawless, not exactly a plum posting, I would say. However, he made a big splash there, obviously wanted to be one of the best dressed men in Cape Town, like Astley Cooper, best dressed man in London. And also, he was jolly good at the surgery. As well as that, he was fun to be with. So he's the sort of person you might want to invite to a dinner party because he would be charming and entertaining. Somebody that he knew well gave him a letter of introduction to the governor of Cape Town, this chap here, Lord Charles Somerset. So again, it's about who you know. Now this chap had a bit of scandal of his own attached to him. Instead of marrying amongst the aristocracy, he'd eloped with a 16-year-old nobody to Gretna Green because he'd fallen in love with her, and they got married at Gretna Green. So that's quite a cute story, but I think probably the reason he was in Cape Town was what he'd done about his marriage. So he was sort of banished to Cape Town. Unfortunately, Elizabeth died on the way to Cape Town, and so by the time he got there, he was widowed and a little bit scared of and unhappy with doctors, I would think. So when this guy turns up, great surgeon, good reputation, fun to be with, they made friends basically, and rather unexpectedly, the two of them became quite close. So he became the Somerset's doctor, and Lord Charles Somerset was married again by this time. So this is a pretty good start to a career in Cape Town, I would say. I put this one up because the red wig is pretty obvious on the picture. I don't think I'd be wearing one like that, but there you go. So with the sponsorship of the governor, Barry picked up the following jobs, all of which had a substantial salary attached. Quite impressive, isn't it? So as well as having a big private practice, he must have been jolly loaded because all of these jobs had a decent salary attached to them. So he was doing pretty well within a couple of years of landing in Cape Town. And he became famous, basically. Now, I think, like with all famous people, you make enemies. And this was especially true of James Barry because he was, I think, a bit cruel, perhaps, to people. I think he wasn't fun to work with. There are lots of stories in the book of him doing unexpected inspections and ripping the skin off people that he was supposed to be inspecting. So probably one of the first documentations of institutional bullying going on in the hospitals he was inspecting and the prisons he was inspecting. So he had a lot of enemies by this time. And I think it's probably one of his enemies that generated the first bit of scandal that was really attached to him. And the scandal involved him and Lord Charles Somerset. And it's pretty shocking. It was written on a placard which was posted up on a bridge. And it described these two being caught in flagrante. Now, you can imagine how this went down in 1824. So, basically, it was discussed in Parliament in the UK. Lord Somerset almost lost his position as governor, hanging on by the skin of his teeth. Barry lost all his lucrative extra jobs, so I guess his income dropped very, very quickly. So from being a very famous surgeon and a big man about town, he suddenly found himself forced to live on his army salary. So, how did he come back from this? Well, this is a case that I'm going to talk about. In 1826, so 2 years after the scandal, he was called to the delivery of this lady, Mrs. Munnick. She'd married into one of the richest families in Cape Town, who basically were tobacco-based. She had been trying to deliver her first baby for several days. Okay, and this is what it was like in those days. You laboured for days. If the labour was obstructed, you died, the baby died, usually. You only have to go around the graveyards in the UK to see that. Young women in a grave, dated 18-something. At the time, not many people had attempted caesareans, but it had been described in the literature, the sort of operation that you did. So, very bravely, he decided to do his first caesarean section on the very wealthy wife of the Munnick family. So, no anaesthetic. They tied her to the kitchen table with ropes. They gave her so much brandy that she was almost insensible. And they gave her something to bite on. You can imagine what it was like to be Mrs. Munnick in this situation. Now, the quickest way into the uterus is a classical caesarean section, and those of you that have done some obs and gynae will know this is a longitudinal incision on the abdomen, a longitudinal incision on the uterus, and the baby's out within about 10 seconds. Repairing it takes slightly longer. The blood loss is usually quite something. The infection risk is quite high. So this was a jolly brave decision. No antibiotics, no blood transfusion, a woman who's at death's door anyway. I suppose it was a do something or watch her die situation. Anyway, he did the caesarean. The baby was okay, which is amazing after several days in labour. And after a slightly prolonged recovery, she survived as well. I don't think she attempted any more babies, thank God, because the second one might have killed her. So, a lot of talk about this, you can imagine. This was the first time where both the mother and the baby had made it through a caesarean section that we knew about in the Western world. People were writing back to England saying, guess what's happened in Cape Town? This guy is really famous. So really, his star was on the ascendant again. He became the favourite surgeon. His private practice came back again. And so, you know, his reputation was completely restored. Like, very smartly, he didn't take any money for this feat, but he asked that the child should be named James Barry. This means that his name will be talked about for generations, because the family didn't just call this baby James Barry, they called all the firstborn sons James Barry for the next few generations. So I suppose if you want to be famous and leave a legacy, this is a pretty smart thing to do. Now, I hadn't realised that this was a pretty smart thing to do, and I've only had one baby called after me, but I think I might be working on this in the future. So this guy here is a James Barry. I don't know if anybody knows who that is. It may be a bit of a difficult one. He was one of the apartheid government, the Afrikaners. He's General James Barry Munich Herzog. So he's the last one of the line to be called James Barry, but that's within living memory, isn't it? Right, let's talk about the rest of his career. It's got a sort of flavour of islands. The army posted him to quite a lot of island posts, and I do wonder if that's because he was quite a difficult bloke to work with and they didn't want him back in the UK. Now, he also travelled with a manservant who was called Black John for obvious reasons. That was quite an unusual thing in those days. So this guy basically lived with James Barry for very many years and looked after his clothes and all that sort of thing. He also had a white poodle called Psyche, but I think that probably is not a photograph of the poodle. It doesn't look like a poodle to me. It may well be Psyche's predecessor. But basically, he was a bit unusual in his personal habits. He also spurred a lot of gossip about the things he took with him. You know, army people are supposed to travel pretty light, aren't they? But he took large amounts of bed linen and his own special pillow with him. And also, this was a source of gossip, he never undressed in front of any of the other officers that he was sharing a cabin with. So it's something a bit odd about this chap. One of the stories I particularly liked, when he was in Corfu, the people that came into his hospital were mainly army casualties from the Crimean War, and he was jolly good at looking after them. So the death rate drops massively. This is still pre-antibiotics, isn't it? Pre-blood transfusion. So he decided that he would go and visit Florence Nightingale's hospital, completely uninvited, and I should think jolly unwelcome as well. He spent his holiday doing it. So he went across there and inspected the hospital and then dressed her down in front of all her staff in the courtyard in the front of the hospital. So again, another documented instance of institutional bullying. Now, actually, Obs and Gynae have got a bit of a reputation for bullying at the moment, and we're obsessed with how to avoid bullying in the workplace. So I was quite interested to read this. This must have felt awful from Florence Nightingale's point of view. So not a nice bloke to work with, really, I think. Now, rather stupidly, he didn't save for a pension. And I think some of us in the room have been talking about pensions quite a lot over the last couple of years. He didn't do anything about his pension. So when he ended up in London in retirement, he couldn't afford to live anywhere apart from a rented room that he rented from a dentist. So he had a rather impoverished old age. And in 1865, when there was an epidemic of dysentery, he was one of those that died during the epidemic. But he did make it to quite a good age, 76 in those days, pretty good. So that's his tombstone in Kensal Green Cemetery. Nobody wanted to do a post-mortem on dysentery patients for obvious reasons. You probably get it yourself. Now, his will was a bit weird. He didn't have much money to leave or many possessions, but his will stipulated that he was to be buried in the clothes that he died in. He didn't want his body washing, he just wanted to be buried straight away. So, Sophia Bishop was supposed to be laying him out, took no notice of that and took his clothes off and discovered that James Barry was actually female, which is totally shocking. Not only that, he had striae gravidarum and therefore had probably been pregnant at some stage. So a lot of the scandal starts to fall into place now, doesn't it? She tried to blackmail this guy, Major McKinnon, an army surgeon who'd written the death certificate. He refused to be blackmailed, so she went to the press. A bit like they do these days, the tabloid press absolutely love this, and there was a massive scandal. I guess the press probably paid her well for the story. So all of a sudden the whole of London and then the whole of England found out that the famous Dr. James Barry was a woman. And we think the historical research suggests that his name was actually Margaret Bulkley, and he'd been born and brought up in Ireland, was actually related to James Barry, RA, who was Irish, but had changed his name and dressed as a man to get into medical school in Edinburgh. So, the year that he died, Elizabeth Garrett Anderson was taking on the medical establishment, trying to get into medical school. So this is the first female British doctor, Elizabeth Garrett Anderson. So I'll just tell you a little bit about her because it's sort of relevant. She passed her medical finals in 1865, which was the year that Barry died of dysentery. She looks a little bit like James Barry, actually, doesn't she? I thought you'd like to see the lead editorial from The Lancet of the same year. The wording is lovely, isn't it? A lady has penetrated to the very core of our hospital system and is determined to effect a permanent lodgment. The Amazonian army has threatened our ranks on paper. That's lovely, isn't it? So there was anything wrong with her. She was clearly clever. Admirable purpose, highly respected for her excellent bearing. She's taken the courses in materia medica and chemistry. She's also applied for admission to anatomy. Shock horror, a woman cutting up a dead body. How should we have received her? Should we resist the charge of the parasols? Brilliant. The other possibility is that James Barry might have actually had a disorder of sex development. So he might have been 46XY and had androgen insensitivity. Some of these patients present with what are thought to be hernias and actually turn out to be their testes and inguinal canal. So maybe he had a personal reason for writing a thesis on hernia. Who knows? We'll never know because, of course, he didn't have a post-mortem, having died of dysentery. So my source material, these two books here, I didn't put this in at the beginning because the first one is called Dr. James Barry, A Woman Ahead of Her Time. So that would have given it away right at the start of the lecture. The second book, The Secret Life of Dr. James Barry, Victorian England's most eminent surgeon, is about to be made into a film. So I thought actually you might be interested to hear about him and maybe go and see the film when it comes out. This lovely lady, Rachel Weisz, is going to play Dr. James Barry. And I'm not sure how much it's going to stick to the true life story because of course you need a bit of artistic license if you're making a film, but I think the basic story is interesting anyway, isn't it? So that's all I've got to say about James Barry. I hope you've enjoyed hearing about him at a week's notice. Thank you.